Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about the menopause. In particular, I will cover what is the menopause, how you treat menopause, and how you can more successfully live with the menopause. So we start with what it is. Menopause is the permanent end of menstruation and fertility, defined as occurring 12 months after your last menstrual period. Menopause is a natural biological process, not a medical illness. Even so, the physical and emotional symptoms of menopause can disrupt your sleep, sap your energy, and, at least indirectly, trigger feelings of sadness and loss. So hormonal changes cause the physical symptoms of menopause, but mistaken beliefs about the menopause transition are partly to blame for the emotional ones. First, menopause doesn't mean the end is near. You've still got as much as half your life to go. Second, menopause will not snuff out your femininity and sexuality. In fact, you may be one of the many women who find it liberating to stop worrying about pregnancy and periods. Most important, even though the menopause is not an illness, you shouldn't hesitate to get treatment if you're having severe symptoms. Many treatments are available, from lifestyle adjustments to hormone therapy. So the symptoms. Technically, you don't actually hit menopause until it's been 1 year since your final menstrual period. In Europe, that happens about the age of 51 on average. The signs and symptoms of menopause, however, often appear long before the 1 year anniversary of the first or final period. They include irregular periods, decreased fertility, vaginal dryness, hot flashes, sleep disturbances, mood swings, increased abdominal fat, thinning hair, loss of breast fullness, increased abdominal fat, as I said. And so the causes of menopause include the natural decline of reproductive hormones. As you approach your late 30s, your ovaries start making less estrogen and progesterone, the hormones that regulate menstruation. Also, the post-ovulation surge in progesterone, the hormone that prepares your body for pregnancy, becomes less dramatic. Your fertility declines, partially due to these hormonal effects. These changes become more pronounced in your 40s. Your menstrual periods may become longer or shorter, heavier or lighter, and more or less frequent, until eventually your ovaries stop producing eggs and you have no more periods. So a hysterectomy that removes your uterus but not your ovaries usually doesn't cause menopause. Although you no longer have periods, your ovaries still release eggs and produce estrogen and progesterone. But an operation that removes both of your uterus and ovaries, a total hysterectomy, and bilateral oophorectomy, does cause menopause without any transitional phase. Your periods stop immediately and you're likely to have hot flashes and other menopausal signs and symptoms. Also, chemotherapy and radiation therapy. These cancer treatments can induce menopause, causing symptoms such as hot flashes during the course of treatment or within 3 to 6 months. Because the menopausal transition occurs over months and years, menopause is commonly divided into these stages. Perimenopause. So this is the time you begin experiencing menopausal signs and symptoms, even though you still menstruate. Post-menopause. Once 12 months have passed since your last period, you've reached menopause. So next is, how do you treat menopause? So the menopause itself requires no medical treatment. Instead, treatment focuses on relieving your signs and symptoms and on preventing or lessening chronic conditions that may occur with aging. So treatments include hormonal therapy. Estrogen therapy remains by far the most effective treatment option for relieving menopausal hot flashes. Low-dose antidepressants, so venlafaxine, an antidepressant related to the class of drugs called selective serotonin reuptake inhibitor, has been shown to decrease menopausal hot flashes. Gabapentin, or Neurontin, the brand, is a drug approved to treat seizures, but it also has been shown to significantly reduce hot flashes. Clonidine. So clonidine is a pill or patch typically used to treat high blood pressure, may significantly reduce the frequency of hot flashes, but unpleasant side effects are common with this. And biphosphonates. Doctors may recommend these non-hormonal medications, which include alendronate, which is Fosamax, and risedronate, or Actonel, and Bonviva, to prevent or treat osteoporosis. These medications effectively reduce bone loss and your risk of fractures, and have replaced estrogen as the main treatment for osteoporosis in women. So selective estrogen receptor modulators, or SERM, are a group of drugs that include Evista. So Evista mimics estrogen's beneficial effects in bone density in postmenopausal women without some of the risks associated with estrogen. And vaginal estrogen, to relieve vaginal dryness, estrogen can be administered locally using a vaginal tablet, ring, or cream. This treatment releases just a small amount of estrogen, which is absorbed by the vaginal tissue. And finally, how do you live with the menopause? Fortunately, many of the signs and symptoms associated with menopause are temporary. Take these steps to help reduce or prevent their effects. So cool down the hot flashes, decrease vaginal discomfort, optimize your sleep, strengthen your pelvic floor muscles, and eat a good balanced diet. Don't smoke cigarettes. Exercise as much as you can. Try yoga or Tai Chi. Schedule regular checkups with your doctor, and practice relaxation techniques, and use aromatherapy and massage therapy to relax and de-stress. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing the menopause more effectively. To start with, we have numerous products to get you started on an exercise program, such as exercise balls, floor mats, weights, and various other items to get you up and running on a program we create together and is tailored especially for you. We also have various supplements and products which you can purchase from us without prescription, such as Replens, fish oils, Clean Marine, Vagisil, Menopause tablets, and Evening Primrose oil, Phytosoy, Starflower oil, Melissa Dreams and Calms, vitamin D and vitamin E, and of course calcium, ginseng. We also supply light boxes for increasing your mood, and blood pressure monitors and blood sugar monitors and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing the menopause with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.